Health. My name is Elliot Smith. I'm with Convener Health in Ohio. I'm going up there because I'd like to continue the conversation. Collaborate. I hope you know. I'll start with a word of prayer, and then I'll kind of go over what we'll be doing here. Lord, we thank you for your grace to allow us the opportunity to learn, to collaborate on ideas of how to best support our teams wherever they are and ourselves. Lord, we thank you so much for your grace that gives us life, that gives us the ability to think and to process, and help us just to process thoughts and ideas and to contemplate new ways that we can. In Jesus' name, we said together.
Amen.
I already started without you, Jay. I'm sorry, man.
I gotta say, and you think you're in the right place. Call the flight number, and you said this. I was in 116. I apologize for that. But I do want to make an introduction to Elliot because something that impressed me about meeting you yesterday. And I said, what would you like me to say? And that says a lot about what comes next. Well, I'm a musician. In the introduction, start with, I'm a musician. So, great. Then he said, 17-year-old, the 17-year-old is a daughter, you're also a boy. And lead the spiritual care at the place in Calvary. I just want to say thank you for taking that order and for family first and then the call to ministry. I needed to say that as an opening. That's what I look forward to hearing from you today.
Thank you. Thank you. Very good musician because I believe ministry. Lives and their other than I am troubled because families, and trust me, we experienced that. I work in about a 400-bed hospital, level 2 trauma center. Just over 400 COVID patients in that hospital. Talked about that with our staff. We said that's basically filling up the hospital and saying everybody died. And obviously it exponentially grew then. And go over some things about grief recovery and talk about this trauma that our staff are going through. I get emails from Becker's Healthcare. I don't know how many of you also get their emails, but I was interested, talked about kind of the phases that they expected us to go through. I'll see if you identify. Is that the first phase is disaster hits. Okay, pandemic starts. Second phase is the honeymoon period. Hospitals have talked to staff who lament the end of the honeymoon period. Tell you, I have talked to so many nurses about the grief that they experienced because they said, how is it that just a year and a half ago we were the heroes? And so that honeymoon period is being looked at. Top followed by the valley. And hospitals, in my hospital, it's a bad phrase to say we're out of the pandemic. Inpatients, which we celebrated, but now we've started to see it go back up. I just looked at our numbers today, and we're at 15 COVID patients. Now, again, maybe we're not in that recovery phase. I don't want to take that. It's kind of scary to talk about, but if Nurse Management Magazine in March, just this year, I had someone give this to me because they know this is my focus. I don't know, how many chaplains do we have here? Okay, quite a few. Hospital asked me to focus that way. My job shifted, and it is shifted. Well, and it's interesting because there is still an argument about your hospitals in terms of what's the role of the chaplain. Patients and families, and my argument would be, yeah, it is. What they said is that before COVID, healthcare research is that before this even hit, there was lots of literature experiencing burnout of frontline staff. Then COVID hit. Been ignored in healthcare work environments. This is part of the burnout. This is part of the grief. Military, much like the police force, where you cannot say, I'm hurt. It is just that our nursing cohorts in the inclusive COVID units have started to report to me that in their anecdotal conversations, 85% or more of the staff on one of those units either started or are desperate. They're choosing all kinds of things to try to care for themselves. Or to say, I'm not okay. How many resident physicians? And I could go on a long conversation about that, talking about people growing up in this health system. How much do we make it possible for them to confidentially come to someone and say, I'm struggling? Now we have the perfect storm. This is in March of 2020, so just a couple months ago. So they're saying this is the perfect storm. I read an article recently that says we are in what's called resignation. Have basically a lot of people saying, Our health network, just probably about a month ago, proclamation that challenged leadership to say, we are in now of trying to recruit new staff. Your focus is now simply trying to retain staff.
Right.
What are you doing to retain them? When you think about that, that makes a lot more sense, doesn't it? Just if we can retain who we have. And I would argue part of retaining is this issue of building a culture that assists them in that process. This, you don't have to take notes. I'll put this on the website. I have my email right here if any of you like me. Health systems. And I can say that in our discussions there in my hospital, the Kettering Health Main Hospital, we implemented, and we had implemented, and we started to talk about how we're going to implement some of these. That's how you have to check this. You're not going to do that behind your desk. Next, maybe, but best is if you go up to the unit one-on-one. Back to that fear that many healthcare providers have of saying, I'm hurting. Second, be vigilant for signs of emotional distress and PTSD. I want to stop and just talk about that. Talking to some other people, I've gotten some reactions of, wait a second, that's PTSD, isn't that war? Well, here during the COVID pandemic, by HR company says some researchers of post-traumatic experience that shatters one's worldview, values, and deeply held beliefs about themselves, others, the world. They wanted to expand it to encompass what we've just gone through. Probably about 6 months ago, I was talking to a peer who works in the talking to him about, we're trying to support our staff and we're struggling to find ways to do it. Throughout the idea, he said, well, have you talked to a military chaplain? Should I do that? And he says, well, they deal with PTSD all the time. Some of our healthcare staff. I don't know what that means. Health stream in our world, which in our network is kind of how we do. We ever thought about helping staff become educated of what does emotional distress look like? So they themselves, and more importantly, they can identify the team. High seeking mental health support. As I said, staff are beginning to talk more and more about kind of this pharmaceutical ways that they're trying to get this. Help in sharing the experience. Either currently or in the past. That's got to be. It's okay if leadership says it's okay.
At least here in our Central Florida, we have been doing a lot of health. Has been to actually hire mental health consultants And what we do in our hospital is we round with the mental health consultant, so the chaplain and the mental health consultant round together on the units for that purpose,
That-
stigmatize.
Talks a lot about mission, as I'm guessing you do. So it's not necessarily a foreign concept to reemphasize. We have a deeper purpose in what we do here. We have, but it's interesting again to talk to staff, and I'm going to talk a little bit about this. Is that one of the things that hurt, I think, during the COVID pandemic, staff who were onboarded during the pandemic. Think about that for a second. I know in our situation is we shortcutted things and just tried to get people onto the unit to be able to help. But what have we done maybe staff to make sure they understand our purpose and our identity? And I won't go into this, but what does that do in terms of the traveler? I don't know how many of you have travelers.
Go ahead, teach. Now you're talking.
That's a dynamic that affects the purpose and identity.
That's right.
And again, you think about, again, the crisis that's in our hospitals is that dynamic has, again, caused a perfect storm. In terms of the last year and a half, we have had patients and family members getting meaner and uglier and uglier. How willing are you as a leader to go up and support your staff and say, you do not have to tolerate someone talking to you like this, touching you, threatening you? That happens. And many times staff won't report it because their feeling is, rightly or wrongly, is, well, they won't do anything. That's just part of the job. And what we have to do is we have to basically say this and then demonstrate, we will support you. And anybody else, any other resource in our facility, you.
We have now two K9 units in the hospital for support of the staff. And we were in a location very diverse political views, so COVID views too. And we did have, and the staff feels comfortable saying, I don't want, I don't. They see the dogs.
Those aren't pet therapy dogs.
No.
We actually, in some of our system, put large signs up at all the entrances that basically spelled out a code of behavior. Our staff have done this, and this is what we expect of you. In other words, setting the stage right when you walk in the door. Our security has been wonderful. Our police, our internal police, so that the staff know now if something happens, pick up the phone, call the police, and they'll be there. During the pandemic. What kind of refresher course do you have for staff who've been kind of fast-tracked through the system to go back and say, well, we want to re-talk about some things that maybe you didn't get to hear the first time? Article that talked about the most stressful position to protect, but also support them because upper management in the front line. And so them, supporting them, educating them, being about don't assume what people are doing. One of the challenges we had is that we had staff who said, we want help. Like what you did, we said, well, we're going to bring in mental health there. Got that reaction of, well, we don't know them, it's stigma, how are we going to? Started finding is the best people for them to talk to with each other. Now the question is, how do you do that? I mean, of the workday. I would argue that's probably not the best strategic way to do it. What about I'm talking to the Ohio State University Medical Center at the beginning of the pandemic, what they do for staff support. And I was blown away by some of the things they did. They had all kinds of programs, and I can send you the link if you're interested in it, because it was self-care, it was mind, body, spirit kind of things. It's a secular center, but they were very cognizant of the spiritual component. And what they said was, and this was their argument, down there, they said, if you really want to prioritize staff, you'll pay for them. And so what they said was their support groups that they did were paid during the workday. In other words, they would accommodate staffing so that you could go attend for an hour, whatever kind of workshop or thing you were doing. Something to talk about, something to consider. It says show up, recognize people, and find things to celebrate. Support or how we celebrate, we've got to be very careful with. The staff got very jaded at what they considered to be fake support.
Oh, yeah. Yes.
So that's a very difficult kind of tightrope to walk. And how do you recognize that? How do you celebrate that? Again, it's different. It felt different, and even right now it feels different than it did. But isn't of we are helping them to identify what do we want to support? What do we want to celebrate? And many times it was simple things. So, I mean, their kids got married, their grandkids got married, baptisms, confirmations, that stuff all kept happening during the pandemic. Did we celebrate it? Did we recognize it for it? Journal of American Medicine talked about this, healthcare professional spirituality in COVID-19. This was a very fascinating article. And what they said was accepting human finitude or finitude with humility and focus. Healthcare crises such as pandemics. Furthermore, by enforcing such a perspective, healthcare providers may begin to rediscover a spiritual significance to their daily work. Beth, I can't tell you how many are effective, the timing of the treatments, all those kind of things. But what we can celebrate are the things along the journey. And this is part of is that their grief was typically over feeling like a failure. Is that we're losing patient after patient after patient. What we started talking about was what was the relationship you had with that patient and that family between the time they were. In other words, were there things that you could say you provided something special and unique to that person, sacred to that person? That was stuck against this kind of performance mindset of, well, that's fine and dandy, but I'm still built to be able to provide X. But again, it was amazing. Out, where am I putting my value? Am I putting my value just on the result, or am I putting my value on every interaction I have with that person? That was something that was unique in terms of talking to them about that, because it reshaped the concept of when you walk into the room, are you valuing that conversation? Are you seeing something that you can provide for that person? that may not, again, meet the standards of what you thought before the pandemic. Them a smile. Maybe that's what you're going to remember. Maybe it was touching their hand with gloves on. Maybe it was that what can you identify in that encounter? You're going to say, I'm grateful that I had that encounter with that person.
What is making it, what does it make it meaningful?
And this is even possible, I think, with people who are on the phone. And again, that's what COVID was doing to us, is it was just about telehealth in a completely new way in terms of how could we interact with people over the phone or over video conference. Importance of those conversations. That again, sometimes we would diminish those things because say it's not as important as it is face to face. But again, you revalued those things when you said it's better than nothing. This was the interdisciplinary part of that. We can't do it after. We can't pay them for it. During their shift. Now, how do you get a group of nurses to be able to come together for a debrief session during the shift? What happens to patient care? Disciplinary part. Because we said, leadership, we need you to step up. And so what happened was the director, the chief of nursing, medical officer, all kinds of clinicians stepped up and said, we'll take care of patient care for that 30 minutes to allow all those nurses to step aside and go to the conference room. I did a couple of things. What did that? Then
Servant leadership.
it was empathy.
Leadership.
Yeah. Empathy with leadership. In terms of, wow, the chief nursing officer is going to come up here, put on a gown, and take for that 30 minutes. We had, you talk about blowing nurses' minds. So, and what we found was to get the nurses together, the peer-to-peer support, is that one of the things that we found the best thing that was the main, I'd say, blockage for them to go through grief recovery, is they thought that what they so of the unit suddenly being able to verbalize those things, suddenly be able to send messages to each other. Suddenly those boards that the nurse managers have up on the wall that were kind of affirmation boards, suddenly were very personal messages. Shift and day shift. People wouldn't see each other for 3 or 4 days, would leave a message for someone saying, hey, I'm thinking about you, and whatever it was that they talked about. Now, I'm not going to say that we're in that I saw basically from a Journal of Harvard Business, which is not a medical journal at all, that companies have been engaged in an arms race to offer the best perks. Employees today want to be treated as people, not just workers.
Yes,
I'm going to go back to the gifts. there's a completely different thing at that point is, at least as I've talked to people, is we can't do those things to the employee and give whatever that gift is. What's interesting is, as they like to say, means something completely different when it's given with empathy. Stations throughout the hospital. If you're never not an aromatherapy guru, so don't come in here asking me for, the oils and all that kind of stuff. But what we found was there were people that were very what was neat about this is that we had the oils there. You can see cotton balls. They would put a little drop in a cotton ball and stick it there in their mask. And that way, everywhere they went, they could smell that scent. This was a big investment by our leadership. 2 massage chairs for the hospital. Now, 2 massage chairs for approximately 4,000 staff members isn't a good ratio. It was something, and this was something controversial. That caused some feelings of angst. For family members, it's just for staff. And in that chapel was the aromatherapy station, 2 massage chairs, some snacks. This is Laura, that therapist, and I found out she's an artist. And so she did these little art things here, little verses, affirmations, and scriptures. We put those all over the chapel. What we found was our chapel from before, when it was used by staff, probably, we didn't specifically track this, but maybe about 5 or 6 people a day. Once we did and what was interesting was we did this with our nurse governance board. Would you mind if we put little slips of paper in that basically are surveys asking for staff to give us feedback? And I thought, I know surveys. No one's telling us thank you. All kinds of well, we've now reverted the chapel back to general use. Now with massage chairs, that they're now the traveling massage chairs. And so what we're doing is each clinical unit so that you can get massaged out, people staring at you when they come in there for lunch. For staff only, you get this massage chair for 2 weeks. And so hospitals have care cards. And this goes to the idea of trinkets. Is you know, my excuse is, it's not an excuse, is I've looked high and low for replicas in this size, and there's no buy it from me. Pranks, wristbands, chapstick. But again, what's interesting, it's done by a person or persons that they trust. That becomes a tool to start a conversation. We have a CPE program. Not to go up and just leave on a unit and let staff load up for them and the family and leave. They said this is a communication tool. In other words, when you have someone come up to this cart, talk about As the conversations that start unfolding as you grab the protein drink or the beef jerky or these are really easy to purchase. What I liked about the company that we actually designed these, in other words, you can import relaxation, just 2 minutes. Just go back there. What I'm going through, it just gives me a little. Table. You can't see right here. This is a punching bag. We call it and this is interesting. As we said, this isn't just for you to go use. So there's some tables there. They can eat their lunch over break or something like that. But what's interesting, done with fewer group. And so we is on that basketball thing. Now, in other words, it's a way to build community. The last thing is, I don't know how many of you have heard of an organization that 1793 organization, and I can send you the information on this. What they've done is they're a nonprofit group that sell their material. They will give you the. So basically, these are well-known devotional books by Otto, Sarah Young. So we have tables. I didn't think that many staff would want these. Books. Themselves, for their children, for their grandparents, for their neighbors. This again becomes just another tool for. We'll just stop there and see if any of you have.
This is awesome. I was wondering, it seemed like complicated feelings as grief. So did you all have to do any work to help them recognize it as grief in order to?
Staff will identify with those two different words. Sometimes it's easier to think, yeah, I'm stressed rather than I'm in grief. So, talked, and again, going back to the military has a lot of information about this. And what the military is what they coach their soldiers to understand is that it's okay to admit you have post-traumatic stress, because what comes after post-traumatic stress is called post-traumatic growth. And a lot of literature that talks about this and actually kind of affirms not grow unless you have stress. And so what they get them to understand is that you've been affected by something, start processing it, and actually there's metrics that they go through with people and say, because of the stress, what have you had to turn to change your life? I appreciated friends more than I did before. I communicated with people more by letter and by other means of communication, by cards than I did before. That's a growth in your communication and connection to some of those people. I started thinking about what I ate. I became. Does that make sense? And so it's kind of trying to coach people into understanding that you can't change what happened, but maybe there's some ways you can grow from it. And I would argue that probably the biggest thing that we've talked about, how has your outlook on life changed as a result of the grief or the stress you've been through? Whatsoever, or are suddenly asking very existential questions in terms of why am I doing what I'm doing? What's the purpose of my connections with the community or with the higher power or being those kind of things?
I've always reflected on in healthcare is are exposed to a lot of violence. There's a hierarchy. And whenever I was talking to my colleagues in healthcare about stressful situations or cases, I always talked about how, like, you're the people I want to talk to. I told this story to a loved one. They would be gasping at chapter 1. And I'd be like, there's like 4 chapters. Like, we're not even to the point. Issues at beds I was caring for. You saw the complexity and you laid hands on them. Shared context alone allows for so it's that sense of understanding and a shared burden or shared experience that's really what alleviates a lot of the need to do something like that.
I don't know, when's the last time you've asked your president to round with you, or your chief nursing officer, or your chief medical officer? But I would encourage you maybe to have that conversation and say, would you be willing to go round with me once? A couple of units, say, we're just going to round to see how people are doing. How conversations start, that's how empathy is developed, that's how connections start happening. And again, sometimes how you start those conversations about bigger questions of how can we work together better to support our staff. I don't think we can hold people responsible if they don't see what's going on. And again, I think I'll come to understand that more and more. We have I call it a small to mid-sized hospital of 400 beds. It's still hard for people to really understand what's going on unless you're down in help identifying what's going on.
Rooms as well, and do you have your own support network for each other?
We do have a support network. I can't say that I necessarily use the rooms. I use the game room. I am guilty of that I like to challenge other staff to the basketball game. So he is a very good support in terms of someone to listen to, as well as other chaplains within our system. We have collaboration and talking through anxiety and best practices and ideas and failures. And it's okay to try something and for it not to go well. Reach in our teams when it speaks. It's okay to plan something and for you to hear from staff, that didn't really do anything. Well, back to the drawing board, we're going to try something else.
Music therapy, do you have music within your rooms? Because music is a wonderful way for people to.
In the when the chapel was going, the soft music being played in there. I can't say that we necessarily have music therapy, although what has come from this, and this is again to create some nurse managers have carved out little closets, and that's now their serenity closet. Walls, and they put little incense things in there, and they have soft music playing, and that's just for their team. But again, that's the neat thing that's happening is that people are
Better for the one-on-one you give. The chaplains here, our leader probably wouldn't speak up. But our vice president of mission ministry took time to have one-on-one with every single chaplain educator for a half hour, even if it took 2 months for us to cycle around, going through the couple. And it was invaluable because that is. That was invaluable. That was the gift of time.
That I would give to you is that going back to we have things to celebrate together. We also learn a thing how to mourn together. Help us know what's going on with your staff so we can support each other as we grieve. And again, it's amazing to think about that. When you truly start touching, at least what I feel is there's more needs among our staff than there are than the patients. Start delving into that and all of the things that are going on. And again, that's collaborating and say, let us know so that we can pray for it. We'd like to send them a card. And hear about you again as a person, not just as an employee. And so think about that in terms of how can you work together to identify those things and to be a support to employees who are going through tremendous things, whether it's in the hospital or just in the community.
Just a comment. I'm a doc, and I see the nurses really carrying the heaviest burden throughout COVID. And it is such a crime that nurses never get a lunch. They never get a lunch, let alone a lunch with the body. So this respite room really highlights a nurse's life as lacking in a lot of very basic things. I frequently don't get a lunch, but nurses never get a lunch. And so I'm very glad to hear about the respite room.
It's interesting what you said is that when we identified this, what we heard from nurses many times was, I don't have time to go use the respite room.
Yeah,
For sure.
So we can't do it. And what that started the conversation was, are you working together as a unit to give each other a 15-minute break? Sometimes, there's the nurses in the room, sorry, is that nurses can become their own worst enemy. In reality, yeah, you can. So this became a conversation that's getting bigger and bigger because it's talking about, are we empowering you and sometimes forcing you to take that 15 minutes to get off the unit? That one, but those are the conversations I think are important to have.
Just wanted to thank you so much for putting together the theory and also the practice and showing us some ideas. But something that you mentioned at the beginning about the emphasis when we become chaplains, family members, patients, serving our communities. And after the pandemic, the emphasis shift to staff, supporting our staff. I wanted to add something that you mentioned that has a lot to do with your success at the main hospital we have at the network. It's having a chaplain manager that connects with the leadership, works with the leadership, ministers to the leadership. Support the staff members, but also the leadership. And the leadership trusted you. And so that partnership that we can build with our leaders, and I'm talking about nurses, leaders, physician leaders, and the administrators, and working together, that made the difference. All the feedback that we saw coming from the main hospital and all of the things that you were leading. that partnership with the leaders.
That's the just collaborative effort. And again, nurses are the biggest employee group in a hospital, so I don't think you could do it without nursing leaders. Physician leadership is wonderful. Blessed to have some of that, but also physical therapy. All kinds of pieces of the hospital. And again, start showing you as you start expanding this kind of effort to help people grow, just how many webs there are in the hospital of people that connect to each other. I want to end with this, is that when I started at the hospital 5 years ago, I've been there 5 years, I started asking patients in the hospital, who has been the most spiritually supportive employee in your stay here in the hospital? And I heard one category of employee more than. That surprised me until I met some of the EVS staff. And again, the patient said is that was the one staff member who actually listened to me. Asked me how I was doing this listen. And that how often do I just sit there for 30 seconds and just say, tell me how you're feeling? And again, what I saw by this is, you think about that surgery, not the incredible care they received, they're going to remember that janitor who listened to them and talked to them. I tell that story in our orientations now, and I say that's something anybody can do. It doesn't matter what your title is, doesn't matter how long you're working here in the hospital, you can each be that gift to somebody. I'm going to encourage you to think about this. I'll leave this kind of as an open-ended question, is that talk to your, if you haven't already, press. I've just got some things and print offs here that I printed off, and it's basically incredible information in terms of without them having to leave and go get treatment, because again, you think Harry, they can't do that, they have to stay there. I'll leave you with this, that one of our physicians, his name is Dr. Hamilton, I'm really close to him because I just love who he is and what he represents. He's a retired Air Force officer and also a physician. And I was talking to him about, how have you done, because he was one of our intensive whole 2.5 years. I mean, you talk about going through war together, Dr. Hamilton. And he admits he is still struggling. He admits that he's still working with this, but he said, I was in the military and I served over in Afghanistan. And so what the military required to me is that once I went through a traumatic experience, I came back to the States, is they gave me a week off. They said, you need to take a week, go see a therapist, go get help, and you come back, we'll start processing this more. He said, I never got a week off. He says, that's my fear for the staff, because neither did they. They tell them, take a vacation. You need to challenge me, as he said, are we telling that message to our staff? You can take care of yourself. What are you doing to support the stress you've been through? And if there's any way we can do it, we want to help you. We want to be part of that team. In the hospital, I'd love to continue the conversation. That's my email. So I'd love to get ideas from you. If you have something working in your hospital, I'd like to hear that. Because like I said, we're all kind of scrambling, trying to figure this out. This again, I'm not courageous enough to say it won't happen again. If it's not COVID, maybe it's something else. So thank you so much for your time.